Okay, so quickly be talking about the pharmacology of what's happening. Yes, pharmacology of infliximab. So infliximab is popularly known as what? Remicade. Remicade. Right. So what is this drug? How does it act? Okay, infliximab. So infliximab is actually what? A monoclonal antibody that targets and neutralizes what? Tumor necrosis factor alpha. We are going somewhere. So the tumor necrosis factor alpha, that's TNF, is involved in systemic inflammation. So you use this in curing disease conditions like what? Rheumatoid arthritis, Crohn's disease, ulcerative colitis, ankylosing spondylitis, psoriasis. Most of them have to do with inflammation. All these disease conditions, not most of them, all of them is inflammation. Right? So he said that it acts by binding specifically to the tumor necrosis factor alpha. This will now inhibit its interaction with what? Tumor necrosis receptor on the surfaces. So this will now prevent what? Tumor necrosis factor from exerting its pro-inflammatory what? Effect, which include what? Activation of inflammatory cells and the release of what? Other cytokines like interleukin 1, interleukin 6. So now, when you block the tumor necrosis factor, you now reduce inflammation. All right. So I'm coming to check something. You get the gist. So it's actually the tumor necrosis factor that is like the problem here. Just the tumor necrosis factor that is the problem there. So administration. It is administered via intravenous infusion, typically over what? A 2-hour period. So the initial treatment usually consists of 3 infusions given at weeks. Just when it started, that's week 0, week 2, week 6. So followed by maintenance infusion every 6 weeks, 6 to 8 weeks, depending on the patient's response to the everything. Indications. Rheumatoid arthritis. We have spoken about rheumatoid arthritis several videos. In fact, rheumatoid arthritis more than 40 videos on our YouTube channel. Crohn's disease more than 5 videos. Ulcerative colitis more than 3 videos because it's just a single condition. Ankylosing spondylitis, when we're doing orthopedics, we spoke about all those inflammation of the spinal cord. Then psoriasis, okay, we've spoken about 10 videos on psoriasis, nail psoriasis, skin psoriasis. So all these things are on our channel already. Okay, so common side effects is of the drug. There could be injection site reactions, there could be increased risk of infection, there could be infusion related reactions, there could be headaches, nausea. Right? So precautions. Patients should be screened for latent tuberculosis and hepatitis before starting this infliximab, as it can reactivate this infection. So, alright. So this is it for infliximab, also known as what? Remicade.